I'll like to introduce Dr. Emma Tillman. Emma is a associate research professor of medicine at Indiana University with a focus on pharmacogenomics in pediatric patients. And her talk today is a little bit more educational focused, and I think something I'm interested in as I'm continuing to build and lead a research team. So a focus on how to be a leader and building the appropriate research team. So Emma, I will pass the mic to you.
Great, thanks, Sarah. So I want to start with some disclosures. So I'm a mid-career researcher, continuously striving to become a better leader. And sometimes I still feel like I'm an early stage, which people sometimes remind me, oh, you're kind of mid-career now, but I still feel like I'm very early in this journey. I have no formal leadership training. However, I have read a lot of like how-to and self-help books on leadership, and I've made a lot of mistakes. So I think my goal in today is to kind of share my transition and becoming from coming out of a trainee role into starting to lead my own research program, and some things that have been helpful for me and things that I've done. But by no means am I an expert in this, and I would welcome any any open discussion from any other more senior faculty or even trainees that have said like, that's a terrible idea, that does not work. That would be wonderful. So this can be very open. I've made some slides, but don't feel like this needs to be a formal presentation. I think this is kind of like a soft skills kind of talk, that things that I wish I would have known earlier in my career. So hopefully this will be helpful for someone. So a little outline. I'm going to talk about the importance of a research team, when and how to build your team, and then how to lead your team once you have that sort of in place. And so you may be thinking to yourself, like, I'm a researcher. why should I care about leadership? So this is from a recent statement from Joni Rutter, who's the director of the National Center for Advancing Translational Sciences. And it says, let me move my Zoom here so I can read this. So team science is the heart of everything we do. The pandemic response highlighted what is possible when a team works in harmony with stakeholders and communities. It was with many hands and a large translational science ecosystem that made it possible for us to rapidly answer clinical COVID-19 questions and offer therapeutic solutions in a time of urgent public health need. These partnerships, the people who make them flourish, and this shared vision of are powerful forces that will bring more treatments to more people quickly. Strengthening existing relationships and forging new ones across a community will magnify our collective impact and create opportunities for many of our individual wins disseminate more readily. So I think this is a great, powerful statement of just talking about the importance of team, and not just in our academic research team, but with the pandemic response of industry and public health and academia and basic science and translational science, so many people coming together to answer these clinical questions. So get back on my Zoom. So leadership and research, I think it's a little bit different, leadership and research versus clinical type leadership. And I think many of us probably came to research from a clinical track, or at least I did. But so we think about official leadership positions, and these could be like dean, department chair, division chief, or director. It could be a large research collaboration. So like Sarah leading the MPRINT for our site, or a large P30 grant, or some sort of research consortium, or it could be just your lab. So this could be a small lab or a big lab. So mentoring and supervising staff, postdocs and students, or it could be just an individual project. So even if you're a graduate student and you have one project, you still need to direct the collaborators, communicate with a statistician or other people that are potentially on your project. So I think there's lots of different roles of leadership. So team-based learning. So in the clinical sense, this is what I was very familiar with in my clinical training, where there was a clear path of leadership. So the students reported to the interns reported to the residents, and the residents reported to the fellow reported to the attending. And there's all this like hierarchy of structure of leadership. And from my research training, at least in my individual experience, it was a little bit different, where the PI was kind of above everyone and had direct input into all of the people's things. Where when I was a student on rotation, I didn't have a lot of direct interactions with the attendings, most of my things went through the residents and the fellow before I would report directly to the attending. But I feel like in my research training, even as a student or an undergrad, things were more reported to the PI. And then the PI kind of has, takes care of the technical staff and the staff scientists. And then some of the staff scientists may oversee some of the postdocs and graduate students, but the lines are a little bit blurry. It's not as clear, at least in my experience. And this could be different at different institutions or different places of training. So is it appropriate for me to build a team? I think that's something that I always ask myself. Like, I'm thinking, like, I'm really junior. Should I really be mentoring anyone? Like, what do I know? But I think it's really never too early to start leading, learning to lead. But things that you need to ask yourself before you take on this encounter is, do you have enough time to devote to mentoring? So it's not just free labor. So if you have someone that's going to help you with a project, you need to be able to devote time to mentoring them, and then evaluate your experience and ability to lead and mentor trainees and their respective career stage. So if you're a graduate student, maybe you can take on a summer student, whether this is an undergrad student or a local high school student that wants to learn something about research. Maybe you can mentor them. Or a postdoc, maybe you're taking on an undergrad student or a grad student. And then in junior faculty, maybe you're going to take on a student or a postdoc, or even staff members. And then learning to lead. So in our medical and science training, most of us don't have this formal leadership. It's not like we took leadership 101, but most of our careers, we actually have to supervise and lead many people. And developing into a good leader definitely takes a lot of time and effort. And I think this is like something that sometimes I struggle with these soft skill talks because I want to have references and things. But a quick Google search told me that in 2013, they discovered that 15,000 books, there were 15,000 published books on leadership, which is amazing. So there's tons of resources. And there's a lot of different facets of leadership that we can explore. So I think building your team, this is like, how do I even start? Like, where do I get my team? So I think the first thing is let your mentors and coworkers know that you're looking for mentees. And this could be people at all different levels. So, if you're looking for graduate students, maybe you need to talk to your university and say, hey, I'm trying to recruit for a graduate student. What are the deadlines? How do I get an appointment to the graduate faculty, that sort of thing. And then network with local colleges, summer research programs. I know at IU, we have high school summer research programs. We have undergraduate student research programs, medical student summer research programs, all kinds of different things. So networking with those can let people know that you're looking for people. And then you'll start getting some responses. So I've changed the names, but these are actual emails that I've gotten from different people at different things. So good afternoon. My name is Ella. I'm a fourth year Pharm.D student at Purdue University. I wanted to reach out to you because I've developed quite a few clinical and career interests, in pediatrics being one of my main interests. I'll be on rotation at Riley in March 2023. My preceptor suggested that I may want to reach out to you based on my interests in residency. I've been exploring some opportunities to participate in clinical research with potential poster presentation to develop some tangible skills to prepare me for challenges of residency. And then I got this other one. My name is Jason. I'm a clinical research technician with the ADOPT study team. I'm in the process of applying to medical school. I would like the opportunity to work on an additional research project. Dr. E suggested that you may have a project that I could help with. And then this one, my name is Amy. I'm a pharmacy technician at Riley. I'm also a Pharm.D MBA student at Butler. My manager and I have been discussing potential research opportunities, and she gave me your contact. I would love to hear the opportunities and see if I would be a good fit to join your research. So these are like actual examples of students, trainees, and actually a technician that's kind of going to go to medical school that reached out to me and wanted to do some things. So I think I'm going to go through kind of my steps in like trying to figure out how to use people as part of your research team and how to direct them. So assess the team members' goals. So why do they want to work with you? So are they interested in your research area? Do they just need this as a CV filler? Do they need a project for a requirement? And I've had people with all of these different goals. And some of them, the goal doesn't necessarily make them good or bad. So sometimes you have a student that has an assigned, I have to do 1 hour of research per week for the whole semester, and this is my assigned thing. And yeah, maybe they're not good, but I've also had students like that have been very good and very motivated. Some of them just need, I want to do a residency, I want to match for residency, or I want to apply for medical school and I want to have this on my CV. Some of them are really just interested in pediatrics or whatever your area of interest is, and they just want to figure that out. And then what do they want to get out of this? So they want just general experience. Do they want to present a poster? Do they want authorship? And I think these are good for you to know on the front end. So then we all have the same expectations. And so they're not thinking like, I'm going to be first author on this paper, and I'm going to do this, 5 hours of data collection, and I'm going to get X. So just the communicating the priorities is really key. And then the next thing is communicating the time commitment. So what is the expectation do you have for each member? And then what do they have? So are they planning to commit 1 hour per week, 20 hours per week for the full summer? And then what are their other responsibilities? So do they have a full-time job? Do they have a full-time school? Do they have family? Are they studying for their MCAT? And I think all of these things, they don't preclude them from being very helpful, but I think we all need to know kind of what's on their plate and what you're expecting of them and what they expect to be putting in on the front end, just so we're not disappointed in the end. And then what is the end date? So are they applying for graduate school in the fall? And so they're limited to just this summer. They're a second year student and they have 2 more years of school that they'd like to do this for continuously for 2 years. I think those could be very different on how you would use them in your research program. And then communicate their skill sets. So what are their current skill sets, and could any of these things be helpful to you? So for instance, do they have an undergrad in biostats, or do they like to play around with graphic design? Maybe they would be great to help with some figures for one of your papers. And then what do they want to learn? What do they want to get out of this? So do they want to learn about pediatric pharmacy, or do they want to learn about research or clinical trials or data analysis? Like what's their motivation for wanting to do this? And then clearly define your expectations. So set expectations for total time commitment, total project time, and then the distribution of how much you expect each person to do. Clearly communicate deadlines, so both project deadlines for the student and for the mentee, and then reward them. So for completion of the project, the results will be published in an abstract or a presentation, and then authorship. And that all needs to be clearly defined too. And, how you're going to define your authorship and who gets to be an author and author order. I try to set those expectations very early on and let them know that if you do, just doing a little bit of data collection doesn't mean you get to be an author. But if you are very involved in, the data collection and the data analysis and the writing of the manuscript and the review, and then if you've worked hard, you will be rewarded with authorship. And on most of my publications, the smaller things where I'm using students to do a lot of the work, you can afford to give them authorship when you have 4 or 5 people. Now if it's a large multi-centered study and you have hundreds of authors from lots of different, or hundreds of people working on it from lots of different institutions, one student doing a little bit of work probably isn't going to be an author. But on these smaller things, sure, you can probably reward them with some authorship. And then organizing the project. So before even telling students I have a project for them, I try to be organized. So I try to get at least my hypothesis set out, and I know what I'm going to do. Have baseline logistics and barriers completed. So like an IRB protocol submitted if that was necessary, a data pull, database access, any of those kind of things that are going to hold up time. So I don't want to just have I thought I might look at this and, not have a clearly defined project, because all of those things will take time. So when I'm taking on board some trainees, I want to have most of my barriers done. So IRB submitted, have a data database or data sheet ready for them to just jump right in. And then let these trainees or mentees know what's required of them. So at your institution, do they need to have city training or biohazard training or computer access? Or what are these barriers to them joining your program? And then know what specific tasks they can do. So carve out specific tasks that the research novice can successfully complete with minimal guidance. And then choose tasks that correlate to the mentee's goals, skill sets, and time commitment. So some example of this. So if you have a student that's assigned to you that is required to do 2 hours per week for research for their intro to research class or something, I'm kind of making this up. but maybe they wouldn't be the person that you want to put on, isolating this precious clinical samples for DNA. But maybe they can help with, lab chores and washing glassware and pulling literature for a review paper, or, there may be something that they can do that would be helpful to you, but also not risk ruining your research. Then, if you have a pharmacy student who plans to pursue residency, maybe they can help with clinical data collection. If you give them a good data collection cheat sheet and you talk them through how to do it, and you do, show them handhold for a few patients, they can probably do this with minimal handholding once they get started. And then they may be able to do to draft an abstract or a poster for a meeting. And then if you have a full-time clinical research technician applying to medical school, they may have some skills that they've learned in their job where they can assist with IRB or data analysis or some of these other things that maybe are skill sets that they have some advanced trained skill sets, but that they use for their job, but maybe they just want research experience and a potential publication for their CV, where they're not going to get this for their the work they're doing for their full-time job. So I like to do layered mentoring. So if interested, I try to give research staff, graduate students, postdocs the opportunity to be the point person for students. So I've done this with people I've worked with, where a senior staff member maybe is the point person for all of the students, trainees that are working on a project. So maybe we have 4 or 5 people doing data collection, and then I let my senior staff person work on organizing the students, troubleshooting any questions for them, and then they take responsibility for some of the data analysis, the writing the paper, those kind of things, where I'm supervising kind of the whole thing, but they're the frontline person. So I'm not getting all these, every single email doesn't go to me. They sort of have a bridge of going to someone else before there. Also stay involved and offer education. I find it helpful to meet with trainees that are doing work for me every month or so, sometimes more frequently, and then talk to them about what we're doing. So if we're looking at pharmacogenomic drugs that have pharmacogenomic guidelines, and I'm having them pull all of the drug orders for certain drugs, then I meet with them and say, okay, you've been collecting drugs. If they had an SSRI, do you know what SSRIs are used for? How are those used? Like, why do we use those? What are the common ones you're seeing? And then ask them questions about, so they're not just like looking at words and not learning about it. So I try to do a little bit of education to put things in context. And then ask them, leave it open-ended, let them ask me questions, and give them, an hour of my time once a month or so to, to bounce ideas off of me. And then I also always offer for trainees, like looking at their CV or their, anything that they have to apply for, their letter of intent or something like that. And I think that's a good benefit to have someone that's a faculty type person that will offer those kind of services to them. And then I try to meet my trainees with equal enthusiasm. So if they're super gung-ho, I try to meet that. And I try to be very responsive and get back with them. But I don't, this probably sounds bad, but if they don't have a lot of enthusiasm for a project, I realize they're probably not going to be the one that I'm going to invest a ton of time and interest in. If they're not completing their stuff, I'm not going to try to schedule a ton of things to drag them along. This is should be good for both of us. And if it's not working for them, if they're not very gung-ho about it, then that's fine. It's sometimes they just want to feel this out, and it's not for everyone, and that's fine. So I wanted to spend a little time on getting the most out of your team. I think this is like my nerdy area of what I like to read self-help books about. But this is a survey from 2017. So kind of a bit ago. There's probably updated information since then, but looking at reasons for leaving position. So lack of opportunities was the biggest reason, bad management, toxic workplace, promotion, excessive workload, higher salary or financial stability somewhere else, or inadequate or lack of reward, and then other reasons. So I think that's kind of interesting to think about, why are people leaving and how can we retain people in their position? So the first thing is the lack of opportunity to use skill sets. So would you rather work with people who don't understand you, the job doesn't fit, and you're answering to someone whose focus aren't answering to someone who focuses on you aren't rather than you are? Or would you rather work for teammates that get you, you're in the right role, you're getting career development from those who are around you, and they want to do the best in everything for the position? So this is a good book. Probably many of you have read this, Strength Finders. And it says that, people who get to use their strengths at work are 6 times more likely to be engaged, 7.8% are more productive, and 3 times more likely to have excellent quality of life, and 6 times more likely to do what they do best every day. And so this is a fun little, like you do the survey and it pops out your 4 or 5, I think 5 strengths, and it kind of puts you into these buckets. So these are the big 4 buckets. And then all of these, I think there's 20, 30-ish strengths or whatever. And it kind of puts you into these categories. So I kind of fit in my strengths are in the executing and the strategic thinking categories. And once you kind of, if you do this, I've done it before with people I've worked with, and you hear their strengths and you're like, oh yeah, for sure, you're a harmony person, or you're an includer, or you're a woo, or, you can kind of see that in people once you kind of know that. But if you haven't read this is a great book, not just for managing people, but also for working on teams. It's to know what your strengths are and what other people's strengths are. This is a toxic workplace or company culture. And I think, we think about this sometimes as a big company, or like your big, university or whatever, but I think this is even like in a small group. So in your lab, if you're working with a small group of people, or your group, definitely a positive work environment is going to help. So people want to help. They want to avoid wasting time of complaining. You want to keep your energy level high, and you want to build teamwork. Determine a positive, productive workplace can determine confidence, and then solve problems instead of making problems, and then help make good decisions. And then 7 tips for promoting positivity. So you can see these here. And I think, some of these different people have different things that they value more. So, whether that's developing relationships or appreciating the little wins, but all of these things can be help to make your workplace more productive or positive. And then the appropriate workload. I think this is really important, especially with early mentees and people that maybe are doing this for free. So I have a lot of students that are helping me out, and I'm not paying them. They want to get the research experience, but I definitely don't want to take advantage of them. So make sure the time commitment is goes with the mentee's goals and requirements. The time it would take to complete a task for a trainee may be very different than it is for you. So it may take me only, 10 minutes to do 1 patient for a data collection sheet, but maybe it's taking the trainee an hour, and I'm thinking like, oh, you should be doing 100 a week. Well, that's probably not feasible. So kind of knowing those differences, give the mentee enough to do so they feel engaged but not overworked, and then continue to assess workload and expectations. So an example of this is I'm just starting a project, and some students and technicians that have worked with me before, I sent out an email and said, hey, we're starting this new project. I wanted to see if any of you wanted to, be on board for this next one. And many of them wrote back, I just need to, I'd like to hear more about it, but I want to know about the time commitment. So what I've done, we're going to give everybody 5 patients to do data collection on, and then we're going to meet again the first week in November. And so I think my goal in doing that is let them see what it entails, make sure that they're up for doing it, and then see how long it takes each of them to do 5 patients. So then they can set an expectation like, oh yeah, that I can probably do 5 patients a week. And yeah, if we have, if we don't want to be done with this until, 3 months, then yeah, this is how much I could do, or, reasonably. And then they can give you their expectation for how much they can do, versus me saying like everybody's assigned 200 patients and it's due by, January 1st. And I think, I don't know that that's the best strategy, but that's what's worked well for me. So this is an important one that I have to keep reminding myself. These trainees are not just free labor. So we should be mentoring them, and it should be symbiotic. So they should be getting something out of it. the trainees are completing work that aligns with your research program, but they are also, you want to make sure that we give them something. So they should have time to learn new skills, understand the process, and use these skills, use the skills that they enjoy. And that's, going back to things that they may have useful skills that could help you. So appreciation and reward. I like to do this, especially for those that are working for me for free, but even people that are, paid employees or working for you. I think this is cute, like the 5 languages of appreciation in the workplace. This is kind of a spin-off of the 5 love languages, if anybody's read that book. But the 5 languages of appreciation in the workplace are tangible gifts, quality time, words of affirmation, acts of service, and physical touch. And it kind of gives examples of these, and, physical touch, personal boundaries are important to keep in mind here. But I think these are very interesting things. And sometimes I like to do when we're approaching a deadline, I can see some people are working really hard, and a few of them are need to be working a little bit harder. And there's something, I guess, what was it, earlier this spring, there was like a student appreciation day or something. I can't remember. It was one of those like made up holidays that they, have for, every day is a holiday, I think, but it was something I saw like on a Google thing. It was like some holiday. So I sent everybody a $5 Starbucks card, and like $5 for me is, it's nominal, right? Like buying someone a cup of coffee, but I sent it to like all 5 of these trainees that were working on this project. So, my investment was $25, and I sent these little cards out, and it got everybody excited. They all, within the next week, our numbers of, the data collection got completed. And, maybe that's like a little bit manipulative, but it also, I think they're like, oh, she cares about me. She's giving me this little gift. And I want to make sure I commit, follow through on my commitment to finish this project. And, that's, it doesn't work for everything. And, you can't give everybody, $1,000 or, like whatever, but like sometimes those little kind of things will really help to motivate your team and just help with the morale. And they feel like they're not just like doing, doing busy work for you for free. So a few just summary take home points, then I want to open this up for some time for discussion, but productive research teams are essential in order for us to do our jobs. It's never too early to start learning to lead. So I think this can be done at any stage. Team members are most likely to stay in a position and be able to use their skills and abilities. And mentoring should be symbiotic and not single-sided. A culture of positivity will promote employee retention and increase productivity. So I'll leave it there for open discussion, and see if anybody wants to, kind of share words of wisdom or, tell me like, oh, that's terrible advice. That would never work. Anything that anyone wants to chat about, I'll leave it there.
That was great, Emma. I think Sarah Van Driest has a question in the chat, noting this talk is full of great tips, and I'll agree. And Sarah, do you want to go ahead and ask the question?
Sure. I was just I was curious if you're, you've had it sounds like some really positive experiences with trainees. Have those all been people who sort of just kind of came to your door, or do you do any recruitment? Do you reach out? Do you post? Do you have any thoughts on, for those, especially early on, it feels like getting those first few students or those first few postdocs, it can be kind of hard.
Yeah, I think most of mine have came pretty organically. So my kind of trickle of people coming in now, I have connected with the Purdue Pharmacy School, and anyone interested in research in pediatrics. I've kind of went to their person that teaches their pediatrics in their curriculum. And I say, if you have any students that are interested in doing research, have them contact me. So I've gotten a few, probably 1 or 2 a year. And I usually make them write me, some sort of letter of intent, or, why they want to do it, and then send me their CV, just because that kind of weeds them out a little bit, like if they have to do something about it. And then recently, so we, just like your center, we have a lot of people in transition that are working on like the GUARD and the ADOPT studies where they're recruiting patients, and they're like, 20 somethings that are finished with undergrad. They're deciding if they want to go to graduate school or if they want to go to medical school or some sort of professional school. And many of them are used to working hard, all the time. And now they have this 40-hour-a-week job and they have time. And they all want to do, something to like look good on their, their next step or whatever. And for these large clinical trials, they realize they're not going to get on this publication just by like enrolling patients or whatever. So I enlisted a lot of them and working on these small little retrospective reviews and things that can, they're maybe small papers, but it's, it's bulk for me. It's like, it's, a paper is a paper or whatever. And it's good for them. And then I try to I usually, we have pharmacy residents through IU Health. And so I try to mentor one of them per year. And sometimes, they are required to do a research project. So that is, those are a little more hit or miss because many of them are not super excited about doing research. But yeah, I think those are my main things. And then we've also had some students that are in this I'm not even sure what the class is called. It's like research, intro to research, and it's an internship program, and they assign them to do so many hours of research a week. And I was in super bad spirits about taking on one of those students because I thought this is going to be terrible. And we had one that was just amazing. Like she was probably better than many of the residents or, upper level people that I'd worked with. And then we had one that was like, he's like, well, I'm not working any over the weekend and I don't do any work on, this is a school break. And I was like, oh, okay. I get where you're at. And, I think I've learned a lot about like managing expectations with different people, but yeah, those are my, my venues for trying to get people.
That's great. I love that. I love that connection you made with the people who are teaching the course on pediatric pharmacy. So then, it's just such a natural lead in, if you have questions, you want to have more discussions to reach out to you that way. I think that's something that each of us can kind of put in our pocket as a practical way. Cause you're right. Yeah, I think, I know I get emails from all over the world of people who allegedly want to work with me. And so separating out like, what's the valuable investment, because it is an investment, and taking a chance on a few and recognizing they're not all going to be rock stars. Sometimes you kind of get through it. But I know I haven't come up with a predictive algorithm yet. It seems like, sometimes I think it's going to be a dud and they turn out to be awesome. And sometimes folks that look awesome on paper are just really good at getting that stuff on their paper and aren't intellectually, contributing or even energetically contributing to the group. So.
Emma, one of the things you talked about was that, the relationship needs to be symbiotic and a benefit to both the mentee, but also I think something you didn't capture as much of was their benefit to you. And have you had experience when a mentor is, maybe a good person, but doesn't fit in your group, or, is draining more of your time than giving you support? And what do you do in those situations?
Oh yeah, I think like it's different for every skill level, right? So if it's a pharmacy student that wants to do research for me, and I've gotten, I'll give an example. So I had 3 students reach out to me through the Purdue pharmacy program, and they were all super energetic that they wanted to do this thing so they wanted to do some research so they could present a poster at the ASHP mid-year meeting or whatever, which is a good like recruitment meeting. I said, okay, we'll divide this up. I have this, list of a data set that has, 150 patients. Each of you will do 50 patients, and then we'll go from there. Well, one person got their 50 done really quickly. One person, had 10 done and we're like 2 weeks from the deadline, and somebody else had maybe 30 done. And so at that point I said, this is where we're at. We're not penalizing the one person that's got her stuff done. Can anyone help out to do more? And then I said, but right now, we're at the point where, the one person has fulfilled her commitment. So I I let that person be the lead author. And then the other two were, one was the one girl that had 30 done, actually like stepped it up, got hers completed. And the other girl that only did 10, I left her off. She did 10 patients, like that didn't warrant, I've said, this doesn't warrant that. And, I hadn't invested that much in her. I think it's harder at certain stages. So if you've hired them on as a technician, I think, I've had one technician where I had to fire them before the probation period, and maybe I could have waited a little bit longer. They might have gotten better, but I was worried that they might not after, and I didn't want to get out of that probationary period. This was at when I was in Tennessee, and they had a like the first 3 months or whatever were in this probationary period. And that was, I was really new. It was like the first technician I went to hire, and she was one of those people that definitely looked great on paper. She could recite like all the definitions of real-time PCR is, and she had the whole definition, but she had no idea how to do it. And then I was like, well, you need to troubleshoot this. She's like, oh, I don't like to troubleshoot. And I was like, well, this clearly is not going to work. So I've had I've had those awkward things where I've let them go. I think it's harder when you have a graduate student that seems good for the first, or a fellow or something that's decent for the first year, and then things go wrong, and you've already committed. I don't know that I know the answers for those. I think it's very individualized, and there's lots of, sometimes I think if I had those kind of encounters now, I would probably seek mentorship from someone else in my division, and then probably somebody from their graduate program, or their whatever that is. Students, I feel like they're a little more what is it called? Dispendable. Like I can throw them away. That sounds bad, but I can kind of release them, and with no hard feelings if things aren't going well.
Thanks. So I know we have several trainees on our call today. Do you have any questions for Emma? Or, one of the things she talked about was the need for mentees to feel appreciated and, having rewards. Are there, what to you would be, something that helps give you a good experience as a mentee? I think, when, like you said, the Starbucks gift cards, just those little, $5 things. I know something that, I remember fondly from my years in training was group dinners where, the PI would take you out to eat. And so that's one of the things I try to do once in a while, just to get it, outside of the typical workflow, and give us some time to be ourselves and build rapport among the team. So
as people are thinking of their ideas, I'll chime in that I think the pandemic was really hard on my lab, not being able to do things like lab lunch and whatnot, because we were all working from home. So I had one of my talented research assistants who was pretty good at graphic design come up with a lab logo that we didn't have before. And then we started making, it was like every few months we do a t-shirt or a sticker, or there's Van Dries Lab socks, and a hat and scarf, just, and everybody gets one, just to try to, have something that we were experiencing together, was really helpful. So there's now some vintage Van Dries Lab swag out there in the world.
Yeah, I think swag's a great idea too. I know the Model AD team that I'm on has put out swag and so forth. And actually that's one of my ideas for MPRINT, is to get some MPRINT swag. And so if they'll approve it for our year one carryover, we'll hopefully get some MPRINT swag. So I think most of the people on the call will be able to get some of that.
All right, I'm going to run out here. We have a substitute mailman and my dog's going kind of crazy. I don't want her to get maced. So,
okay. So Sydney has a question, and when Emma gets back, maybe we can address that. Are there other questions? And feel free to unmute and turn on your video to participate. We're looking for this. Yeah, I know I always have a hard time, you know, I think Sarah, you mentioned, you know, try that magic formula of who's a good fit for your lab and as a mentee. And I think it goes both ways. As you know, I've had that feeling when choosing a mentor too, of maybe that's not the right fit for what you're doing. You know, and a lot of it is really personality and, you know, getting finding the right fit in a personality of someone who really understands what you need emotionally and for your personal growth, as well as from a educational and standpoint and professional standpoint. So, okay. Emma, Sydney has a question in the chat of how do you deal with conflict between mentees and employees?
Yeah, I hate it. I mean, I hate that kind of conflict, but you know, it's bound to happen. You know, I think for me, communication is the biggest thing, and try to mediate the conversation, try to mediate what the issue is, and let both sides tell their side and try to just figure out how we can work together. I don't know. I've been in labs or, you know, not just labs, but like working groups of, you know, staff, trainee, different conflicts and things. And even like the lab down the hall or whatever, you know, when I was a Ph.D. student or whatever, there was a lab that was notorious for like all their, you know, the students and, you know, people were all having like issues and whatever. And so, you know, it's rough. And I think it's probably up, I think it's up to the PI to kind of take control and put a stop to it and, you know, say what's acceptable and what's, you know, this is not acceptable behavior. And we're all working together and, you know, make, and I think sometimes some of those things can be like thinking about I've seen conflicts between two graduate students that are kind of both fighting for, you know, the PI's approval or, you know, authorship or whatever. And they're doing kind of competing type projects, and they, you know, both of them want to do well. And in the meantime, they think somebody else is getting special treatment and whatever. And most of it's like misconceptions, right? Kind of, but they both feel the same way because they're both seeing the same thing. And I think just looking at it when I'm a little bit older, like than I was then, like it's easier to see where the communication breakdown is now. But I think when you're in the thick of it, especially when there's conflicts between, you know, everybody talks and people take sides. So like in a lab, you may have, you know, Jenny and Katie are in a fight. And so then, you know, these three people are team Katie and these three are team Jenny and, you know, or whatever, you know, that happens. So I don't know. I think just communicating and just putting a stop to it and air everybody's grievances and go forward. But I mean, in any kind of relationship, you know, you have family conflicts, you have, you know, coworker conflicts, and, you know, it's bound to happen. But I think it's up to the PI to kind of promote that positive thing. And if there's, you know, if there's one person that doesn't work well with any of the group, maybe that's, you know, it might not be that person's fault and they might not be a bad person, but maybe they need to find a different place if they're, you know, if it's not working for them. But.
Yeah, I think it goes back to also recognizing the strengths of the individual and what their focus is important up front. You know, if you know, from my standpoint, I have a lot of quantitative work in my lab, and if someone is not detail oriented, it's not a good fit for them because they have to be able to work through a large amount of data, and you know, small mistakes can make a big difference. So you know, it's just not the right fit for a lot of people, whereas maybe they fit better in another environment. And so there's lots of different opportunities in research. So I think that's another thing to keep in mind if you are a trainee and not in the best situation, or you end up in a training situation where there's, you know, some negative consequences. It's not necessarily you, and it's not necessarily the advisor. It's just, you know, your personalities don't always get along. So.
Breakups are always hard though.
They are. They are. Are there any other questions or comments?
Yes, can I ask one last question? I guess Sarah, you brought up that, you know, mistakes can have repercussions in research and whatnot. Emma, do you want to comment a little bit? Because you have had lots of students and trainees. I'm sure that there have been mistakes made. Can you comment a little bit about kind of how you've handled that in the lab, and just to give advice to this group on that important topic?
Yeah, I think so. I guess like when you say mistakes, like little mistakes or like hiring mistakes, like what?
Oh, I meant like little mistake, like
Yeah.
like someone miscoded something on a form,
Yeah.
or
Yeah.
so, like that you make a research mistake. 'Cause we're human beings who make mistakes.
Yeah.
Can you talk a
So
little bit about how you handle that?
yeah, so I typically, when I bring somebody on board, if it's like a data collection type project, then I go through and I actually do it myself. Like I do every third one, every fourth one or whatever entry, I'll check them. And then I usually have them check each other. So I usually have everybody like, you're assigned to double check this person's or whatever. And then we talk through them and say like, did you have discrepancies? And sometimes they're not even mistakes. They're like, I thought that day 0 counted this and I thought this was day 1, or, like, and just clarifying those. And I usually do that early on where I give people, so many to do initially. And then like more lab work, definitely like if you miss a rinse step or if you miss something, you could have, or like maybe this was really like, we had this really great samples and you ruined it and like the DNA is gone or whatever, like whatever, like all those kind of things happen. Right. So I think, validating that we've all made mistakes, things happen, and not, try to take the anger out of it. And most people didn't mean to do it, right? Like it's not like they're intentionally trying to say something, but if I also, for a student that I'm trying to train on more basic science kind of things, I do very little, like very baby steps in taking them into doing work where they're going to be doing something on a vulnerable sample that that might mess something up. So, I don't know, like the way I was trained in the lab is like my first weeks, like I was given like this pipette thing where I like had to pipette different quantities and then I had to weigh those amounts out on a scale, on a balance to see how close I was with my pipetting, and then set up a whole plate using pipetting this and doing that, and then doing some colorimetric stuff with like expired things. So like kind of like taking them through those kind of things and then realizing like, oh, this could happen, what happened here, and then sometimes if there's excess samples, so like, I trained in doing like a lot of cell culture stuff, and cell culture, like if you mess up an experiment, it's not usually the end of the world. Like you can have some sort of, learn to do DNA on, hep G2 cells, and that's fine. But if you have a human sample, and you're messing that up, that's, for a clinical trial, that's not great. But a lot of times we'll get leftover blood from the lab, that may not be critical. It's like we just like play blood or whatever, so it's real blood, but it's like not for our study or whatever. And then so I've had practice with those kind of things, and then talk through like what went wrong, what would happen with this. And definitely there's going to be things as people, even, the greatest researcher, but I let them know that this is never, if something goes wrong, we need to know about it, because we can't go forward. We can't go forward with like, pretending that we got something and like falsifying data and, like all those kind of ethical things. So I want to make it like what is that? Like a no blame kind of culture where, if something goes wrong, it's fine. We just need to know about it and we need to like make changes so we can go forward. I don't know. That's my approach. I don't know. Probably other people have similar, but maybe other better tips. So
I think that's great. I love how you're proactive about it. Training people up and, finding mistakes early and then discussing it in a non-judgmental manner, like right from the start. So everybody knows that the goal is to end up perfect, but we're probably not going to be perfect the whole way. But yeah, I guess the times that I've seen things go most awry is in those punitive cultures where then people are motivated to hide mistakes, and then things get off the rails pretty badly. That could be career ending for a whole crew of people from the PI all the way on through. So
yeah.
Oh. Are there any other comments or questions on this topic? If not, we'll thank Emma for the wonderful presentation and some really good tidbits of advice on managing people and mentorship. Our next webinar will be on Thursday, October 20th at 2 p.m. Eastern, 1 Central, or 11 Pacific, depending on your time zone. And we'll feature one of our junior faculty members, Dr. Blessed Winston Arul Das, who will be talking about opioid pharmacokinetics and pharmacodynamics in pediatric patients. So we look forward to seeing you then. Thanks, everyone.